Good morning. I'm Amy Suffredini, the chairperson for Farmington Economic Development Commission. This morning, I'm joined by Rose Ponte, 10 feet away, Farmington Economic Development's director, and it is our pleasure to welcome you to the Economic Development Spring Business Breakfast. Like me, I'm sure you wish we were at the Farmington Club having a delicious breakfast and meeting face-to-face, but unfortunately, we all know that is not possible. So, the Economic Development Commission decided to focus on what is possible. With the generous sponsorship of People's United Bank, it is possible to host Farmington's first ever virtual business breakfast. And thanks to the hard work of Rose, Brian, Anna, Kyle, and Devin, using the possibilities that Zoom offers, our incredible and engaged business communities are able to come together this morning. And we are so honored and fortunate to have Governor Lamont and UConn Health's Dr. Agwunobi joining us today to inform you about the statewide response to the COVID pandemic and projections for the future. A few housekeeping details. The breakfast presentation will end at around 8:30. Participants are muted, and at the conclusion of the presentation, we will send a follow-up email with additional information and links. During the past 3 months, our lives have changed in ways most of us could never have imagined. Before we hear from our speakers, I thought it would be helpful to have Rose give us a snapshot of Farmington business community and how it's been weathering the storm. I will now turn things over to Farmington Business's cheerleader, incredible information resource, and leader, Rose Ponte. Rose?
Thank you, Amy. It is a pleasure to be here this morning. Thank you, everyone, for joining us and starting your morning with us. It's been an unprecedented time and filled with many challenges. I have been lucky enough to witness our business community showing partnership, ingenuity, innovation, creativity, and perseverance, all of which took place throughout the entire Farmington community. This morning, I wanted to share some of the ways the business community has responded. As many of you know, here in Farmington, we have a thriving bioscience industry. And very early on, we all understood the importance of COVID testing. And while a lot of COVID tests were scarce, we were very lucky here in Farmington that UConn Health and Physicians Pro Health were able early on to offer drive-through testing, then followed by Priority Urgent Care in Unionville, also offering the same testing. Jackson Labs, the cutting-edge research company, then partnered with the state of Connecticut and the Department of Health and hospitals and medical centers throughout Connecticut to process all the COVID testing. And they increased their capacity so much so that by mid-July, they'll be able to process up to 20,000 tests a day. We all understand now that it is that testing, that very important testing, that will really help us move forward and contain any type of additional surges that we may have. But it wasn't just the testing that was offered here. We had the fantastic medical care that UConn Health offered for those that did become sick with the pandemic. And Jackson Labs and the UConn TIP researchers continue their cutting edge research that they do every day. And hopefully it is that type of research that will come up with life-saving treatments that can help us in the future and maybe even a vaccine. In addition to our bioscience companies, we also have a wonderful manufacturing community. In fact, we have 1.9 million square feet of manufacturing space. Those manufacturers, deemed essential from the very beginning, never closed. They continued operating efficiently and safely for their employees, and they pivoted, many times changing their supply chains to now start manufacturing that very necessary PPE equipment and face shields. They took their expertise in engineering and advised companies on how they can build ventilators, and they even gave advice globally, helping over in China when they erected their hospital in 10 days. It is our small businesses that really were impacted very directly, but they also adapted and changed. Our restaurateurs offered not only takeout and delivery, but curbside delivery. They offered family-friendly meals at affordable prices. And yes, they even delivered grocery staples for those that were unable to go grocery shopping themselves. They partnered together and offered delicious meals to all those in healthcare. And they did it by every restaurant pitching in and doing a different night. So they really showed that camaraderie that is shown throughout the Farmington community. Now that they are able to offer outdoor dining, many of them erected tents, bought more equipment so that they can offer that outdoor dining. Our retailers, many of them independent and small retailers, started offering online options. Many of us needed that type of retail therapy, and their unique gifts, custom face masks, and fresh flowers all allowed us to be able to celebrate with all those we love, all those separated and afar, but maybe they received unique gifts from Farmington retailers, fresh flowers, and they just helped keeping some things constant in our lives. Our many yoga and dance studios and fitness studios started offering virtual online activities to keep us fit. Our construction companies called and said, can we offer supplies, masks that we may have in our inventory? Let's not forget our banks, who in record numbers were able to process PPP loans and SBA disaster loans, not only in record time and in record number, but most of the time, most of their employees were all doing this by working remotely. So we look at our business community and we see not only do they have all the different businesses, but they are also partnered with our cultural institutions. Many of them were very creative and offered virtual tours of all their exhibits. They opened up their grounds to make sure that all of us had beautiful places that we can go to. So in all, we look at everything that's been done in this community, and we look at all the different things that have been accomplished in very challenging times. These are just a few of the examples of the perseverance that we've seen. As we begin to reopen our economy and we look to the future, the landscape will surely be different. But just as we've done over these past 3 months, we will adapt, we will innovate, we will persevere, and together we'll forge ahead. I look forward to working with all of you as we do just that.
Thank you, Rose. And now, without further delay, it is my pleasure to introduce Dr. Agwunobi. He is the Chief Executive Officer and the Executive Vice President for Health Affairs at UConn Health System. In his role, he's responsible for UConn's $1 billion academic health system. Dr. Agwunobi, you certainly bring a wealth of experience and expertise today. We thank you so much for joining us. Welcome, and please take it away.
Well, thank you so much. And thank you to the town of Farmington, the Economic Development Commission, and the People's United Bank for giving me the opportunity to speak at this morning's breakfast. It's great to be alongside you virtually, such a vibrant group of business and community leaders. And it's interesting, as I sit here today in my office in Farmington, I sort of feel, and I think my team does too, that we've been through a bit of a battle, but that there's now light at the end of the tunnel. And before I go into sort of more detail, I wanted to also say that I'm joined today by Dr. Banach, who is our infectious disease leader and epidemiology leader, because I anticipated and I noticed I'm correct that a lot of the questions you might have will be about COVID-19 in general rather than about UConn Health specifically. But if you do have additional questions that you want to send offline, you can send them by email, and we'll give you that. I think that's on the website as well. So, you know, one of the things I've realized going through this is really the power of and the importance of community. And, you know, Rose just spoke to that a moment ago, but we're so proud to be a part of the town of Farmington. That, you know, we're one ecosystem, and the pandemic really showed that we are one, and that if we act as one, we will survive and thrive. And that, I think, is what you're already seeing. So I really want to thank that. And I want to also, because of that, I'd like to start by actually celebrating some of the great work that the town of Farmington has done that we're aware of and that has helped all of us. Communication to employees and the public has been great from the town of Farmington, been very important. I know that they took steps very early on to limit the public safety employee exposure so that the public safety employees can keep us all safe, and that has been critical. The Farmington school system established Connect to Learning for the students in Farmington, and as the parent of 2 teenage daughters, I know how important that is. They've really done a lot to sort of buoy the spirits of everybody through this time. So, for example, there was the hometown rally that was held on Friday evening. The community and recreation crisis services crisis response was actively engaged in community support initiatives, sort of weekly phone calls, applications to the food pantry, dial-ride drivers, etc. So many other services that are critical to people during this time. And the town's community communication platform was modified to a COVID-19 response site. And it goes on and on. I just want to really thank the town's leaders for all the great work you've done, because the work you do helps us and everybody else, and I'm sure the work we've done does the same. Before I get any further, I know that Governor Ned Lamont will be joining soon, and I just want you to know, this is not, I know speakers often start by sort of praising their governors. I want you to know that Governor Ned Lamont, personally, he's probably been the most active leader in the state, which of course is appropriate, in helping all of us to be ready and to fight this pandemic. So, some notable contributions, the quarantine housing program, we can talk a little bit more about that. The Connecticut National Guard that he's made available, the daily briefings, just the presence and leadership of the governor. Human Health has received a lot of supplies from the state stockpile of what the state has received. We received ventilators, 7 ventilators, 17,000 isolation gowns, medications, you name it. So I really have to start, I can't start without thanking them, the governor and his team. And then let's talk a little bit about Yukon Health. So I was saying that we feel like we're at the end of, we're seeing light at the end of the tunnel. We've seen a total of 250 or so, accumulated total of 250 positive patients, inpatients. Today we have an inpatient census of 12. So we're definitely coming down. At our peak, at any one time, we had about 54 patients in-house, which is quite a lot for us. And that's gone down considerably. We also, our workers, our healthcare workers, many of whom are residents of Farmington, have just been phenomenal during this whole time. We have about 5,000, a little over 5,000 employees. 86 of them actually became COVID positive during this time. Now, they all survived, they all did well, they've all been treated and taken care of. But it just shows you that people on the front lines do end up sacrificing for the rest of us. And I just think that that's something that's been really important. So our focus at Yukon Health has been sort of 3 things over the past few weeks and months. The first one is taking care of people. That's really the most important thing, taking care of patients, taking care of employees. And then the second thing was preparing for a potential surge in patients, which thankfully we've not seen beyond the peak that we just went through. And then finally, it's changing to move into the new normal. And the new normal are the services that we're back to providing now. So in terms of patients, I hope none of you had to experience COVID-19, but if you did, you would know that we were the first in the state to put up a tent outside our emergency department, heated, plumbed. It was like a sort of a match tent sort of thing you see on a battlefield, but had heating, plumbing, beds, and everything for evaluating patients so that we could do that safely outside of the emergency department when necessary. We started our drive-through testing center, which we We collaborated with Jack's lab. We had such a tight collaboration. It's just a wonderful thing for Farmington to have this medical biotechnology complex in your town, in our town. It's just an amazing thing. And really, we were always partners with Jack's lab, but as often happens during crises, it is this crisis that really brought us together. So, for example, the electronic medical record that we have, we spent about $100 million implementing a cutting-edge electronic medical record over the past few years, and that medical electronic record is now integrated with Jack's Lab's testing, so that anyone who's tested across the state can get their results electronically through MyChart, through the portal, and not have to wait for someone to call them up, etc. So that's just an example of that. And then we help them in different ways to get set up, as did the governor. We have a call center, which many of you may have used, which is manned by physicians and nurses to make sure that everybody's aware of what's going on all the time. We have screening on our campus. If you come to our campus, you have to have your temperature taken, you have to answer questions, and all of that is about keeping patients safe, and employees, of course. And as you know, we have a visitor policy, which we're looking at now as we get into the new normal, but very restrictive on visitors, not on patients, but on visitors, so that everybody is safe when they come to our campus and we don't have people coming from different places. And then, of course, one of the things you may have noticed most of is that we deferred some of our elective procedures, our surgeries, our routine cases, and we switched to telephone visits and video visits, which have been very successful. Now we're switching back again to people getting their regular care, but during that period of time, that was necessary. In terms of our employees, we sent a lot of employees home. They were still working, but they were working by telecommuting. And then we had about 2,000 of our 5,000 employees actually on site every day, including leadership like myself, making sure that this place was running well for the people of Farmington and beyond. We also redeploy people. So if you're at home working and your clinic is closed, we brought you in. So many of our employees that have never worked in the hospital with COVID-19 patients actually came into the hospital, were trained how to work in the hospital, to help the nurses, to help the doctors, and they put themselves at risk, and they did that, and I can't thank them enough. In terms of the protective equipment, like everybody, we have a limited supply, or had a limited supply, and still do, of protective equipment. But one of the things I'm very proud of, and I want you to know, is that in contrast to some of the horror stories you may have read about or watched on the news, none of our employees ever had to work on the front lines without adequate protective equipment. And part of that was due to the donations of so many wonderful people that I'm sure are listening today, to make sure that we had all of the right equipment. We never had to tell people, well, wear a cloth mask when you're in the hospital, seeing patients. Everybody had standard CDC national guidelines equipment, and still do. So we have all of that. In terms of the different things we did, we very early on, before the CDC even asked us to do that, we had universal masking. So every single person on our campus, not just nurses and doctors, but all patients, even just coming for 1 hour, has to be masked. And don't worry about that if you're coming to us. If you don't have a mask, we'll give you a mask. Every single person has to be masked. And we also practice social distancing. So we have mark on the floor, just like supermarkets. We have plexiglass between people to make sure that that people are all kept well. Now, in terms of the surge, switching sort of the surge capacity, we I should mention, by the way, that we kept our childcare running with the help of the state and others, so that workers could have care for their children when they were coming in and working on the front lines. And any worker who was positive was immediately sent home. And if he couldn't go home, we actually provided, with the help of the state, a place at Central State University where we housed those workers and fed them and took care of them until they were better and negative. And then we also had hotels, Homewood Suites and others, that we used for workers who did not want to go home after shifts. So you can imagine this has been a very, very complex operation, but it's gone just so well. I just want to thank everyone that's been involved. In terms of surge capacity, we didn't need to use our surge capacity, but we actually, many of you may not know, we're licensed for 230 beds. But during this process, we went to the Department of Public Health and actually got our license for beds increased to 680. We've decreased that a little bit. We're now at 611. We had National Guard come in with the help of the governor and set up beds in our old Connecticut tower. So we had more than 100 new beds that were already set up with equipment for FEMA. So we're ready. We were ready. We are ready. And you can be proud of the workers in Yukon Health in terms of their response to this pandemic. So we learned a lot, and we did a lot in terms of innovation as well. One of the things you learn through a crisis is that you need to be nimble, you need to be innovative. So our researchers, the great thing about being part of a university is that we have researchers who have labs who have 3D printing. They were printing face shields, they were constructing, actually making ventilators. Never had to use those ones, we always had enough ventilators, but they made ventilators, they made special protective boxes for when you're intubating people to make sure that they're not spreading germs, and just so many different things that we use. We also, I would say, treated patients in a cutting edge manner. We had all of the ventilators that were necessary. We had all the beds that were necessary. We had remdesivir, the medication. When hydroxychloroquine was being used, we had that. We have convalescent plasma that we're using for patients. So if you come to Yukon Health, you can get the same care that you would get anywhere across the nation. And I would say, in many cases, even better care. So a lot to be proud of there for you about your health system in Farmington. So where are we going from here? So now, I'm pleased to say that we are back to regular services. So one of the key messages I want to get everyone here is you're on the news about stay at home, shelter in place, don't go out. One of the things we realized during this pandemic is that many people need their regular care. They need their knee joint replaced. They need their medication refilled. They need their routine visits. They need their dermatology visits. They need their surgeries, their routine elective surgeries, their hernia operations, their back surgeries. They need all of this. And I think we've realized this across the nation. So what we've done is now that we have relatively few COVID-19 patients, and by the way, those patients are in biocontainment units. So they're actually in special units that have walls that have been created. And within those walls, we put those patients. Everybody in those units are masked and have all of the PPE equipment that they have, face shields and special ventilators. And one of the things to note is that those units are negative pressure. And that means that air is sucked into those units. Air cannot come out of those units. So if you're in a hospital receiving your routine care, you are completely isolated from any patients that are being treated as an inpatient for COVID-19. And we also have a lot of practices on the outpatient to make sure that anyone who's symptomatic, again, we have screening of temperatures, we actually even test patients. So any patients coming in for a procedure or surgery is tested 48 hours before they come in to make sure that they're negative. And we do that to make sure that anyone who's in our facilities is safe, are safe as can be. And so I just want you to know that we have opened up our regular services. If you were seeing a doctor before and you want to see the doctor again, come on in, call your clinic. We'll take care of you. And we've been doing that for a couple of weeks, and it's been going very well. So I want to make sure that you are getting the care you need and that you're not sitting at home and suffering in any way when we're there for you. This is your facility. So I'll kind of end some of my comments by really thanking all of you, the outpouring of community support. There were so many business and community members who either donated their time, or they donated supplies, or they donated money, or they donated food. I mean, you can imagine healthcare workers coming in every day, suiting up, almost like astronauts in some cases, and just doing this dangerous work all day long to take care of people, and then coming out at big time to the break area and seeing that a restaurant has supplied them with food and with cards. It's more than the food. We have a cafeteria. It was really the spirit. It was the community spirit. And I just want to thank everyone for all they've done. We received more than $750,000 worth of PPE and money and everything that people have done. I just want to thank a few particular organizations. Naples Pizza, who led the initial charge for meals and rallied other restaurants in Farmington to do the same. Narcom Mortgage gave a generous donation of a 3D printer. Those who shared baked goods, and all the restaurants who really helped us. I want to thank Homewood Suites and the Farmington and the Residence Inn in Avon, who housed many of our frontline workers as they were going back and forth. We also just want to thank just everyone. I can't say enough for the great work that everyone has helped us with. So in conclusion, thanks again for inviting me to speak with you all today. I'm happy to take any questions. And actually, we do have some questions already. I hope we're not going to run out of time. So I'm going to pause here and see if Amy, maybe give me a time check here.
We have a good 10 minutes. We have about 6 different people have submitted questions. First, I just want to thank you, Dr. Agwunobi. We in Farmington are so appreciative of you and your team and keeping us safe during all of this and having cutting edge information. And I actually really appreciated hearing today that that you're ready for us for our regular visits and our regular surgeries, because I know a lot of people have just been holding tight because they're nervous. But to know that you have the security and the safety in check, I think will make a lot more people to come in. So thank you.
Thank
I
you.
know you mentioned that Dr. Banach is present. I don't know is he up?
Yep, there he is. I see him right there.
Hi, Dr. Banach. Good morning.
Yeah.
I know that both of you are available to answer the questions. We had asked everyone who signed up to submit questions, and we did receive 6 of them. So
Okay.
I'll watch the clock, but I think we're fine.
Okay.
And I'm going to read them, and then you guys jump in based on who you think is best to answer them. And you answered this a bit. Over the course of the last 3 months, do you believe the medical community has learned to better manage COVID-19 patients than at the start? If so, what are some of the most important things that you've learned?
Okay, well, I'm going to just say a few words, and then I'm going to leave all the rest of the questions to Dr. Banach, because I've read them and I know they're more in his field. So we've learned a few things. One is that convalescent plasma, which is people who have had COVID-19 and then donate their plasma for treatment of other patients. We've seen, and again, it's anecdotal because it's still an experimental study. We've seen that has helped patients, particularly those who get it early. The other thing I've learned is that masks and social distancing really do work. We've found that where we have had small outbreaks has been, for example, when employees who are masked sit down together to eat. And when they eat and they take their masks off, then it leads to spread. So I would say everybody should always make sure you wear your masks and keep your 6 feet away, or 3 to 6 feet, whatever the distance, 6 feet. And then I'll turn it over to Dr. Banach, and he can finish up on that and then go to the other questions. Thank you.
One just question about masks. We all have masks. Some of us have ordered them from random places on the internet. Others of us have them from the state. Are there particular masks that are the safest that we all have access to get? Is there a mask that we should or should not be using to put us in the best possible place?
Sure. So, I mean, I think a few features when you're thinking about what mask is appropriate to be wearing, like out in public. Remember, this is maybe different than the medical mask that we think about, that we're wearing in the hospital. So, an important distinction. The key thing is that you get adequate coverage of a mask. So, it's got to be full coverage of the nose and the mouth. Something that is made of a relatively thick material. So, even like a thicker cotton would be adequate. Something that you still can be comfortable and breathable. But I think another key feature, and we see these sometimes in the public, some of the masks have little exhalation valves on them. Be really careful with those, because those actually allow your breath to pass through the mask and kind of negate the whole benefit of it, which is to block your exhalation respiratory particles from leaving your mouth and potentially infecting others. So I always caution against those, and those really should be discouraged. But the CDC actually has a great website if you want to make your own mask. They kind of walk you through it using a piece of a cotton t-shirt, cutting it up. But the key is the coverage, really. Covering the nose and the mouth is the most important piece of it. You know, even a bandana is adequate when wearing out in public too. And the goal is really not so much to protect yourself from becoming infected, but protecting others from being exposed to your respiratory droplets, because you could be one of those people that is still infectious but without any symptoms.
The next question relates to the different tests. This particular person said 30 different tests have been withdrawn because of inaccuracy. Which tests can we trust?
So I think, you know, we talk about testing. There's a few different types of tests, speaking more generally. There's the PCR test, and that's really the diagnostic test of choice at the moment to make a diagnosis of COVID-19. And that is basically a test where you do an analysis of to find the genetic material of the virus, very sensitive, really able to pick up even the smallest quantity of virus. And that's what the JAX lab performs, performs with us. Other commercial laboratories offer this PCR test. It is quite sensitive, so it's able to pick up virus even at a very small level. But the concern is the test is only as good as the quality of the specimen that's obtained. So the specimen that we typically use right now is called the nasopharyngeal swab, basically taking a swab, putting it deep into the nose, into sort of the upper airway area. And the key is really getting a good specimen, because if you don't get a good specimen, the sensitivity of the test is really limited. So specimen quality is really important to maximize the performance of the test. And the PCR tests in general tend to be perform very well. The one with the JAX lab that we use is particularly sensitive, but other commercial laboratories that do PCR testing are very high quality. The challenge, there's a few challenges. The antibody testing, which many have been hearing about coming to the market. There's some concern with the sensitivity and specificity of those tests. There are so many that are out there in the market. We're finding that some of them are more sensitive, more specific than others. We use a test through Abbott, which is probably the most widely used antibody test, and it performs very well. So we have good confidence in the test that we're using, but you know, I think be cautious with the test when you're going to be tested. You know, see what test is going to be used. Many of the the major medical centers in the region use very reputable tests, but you know, especially with the antibody testing, that's the one that's really gotten a lot of attention in terms of the sensitivity and specificity.
Okay. And along those same lines, at least we've heard, those of us who sort of learn a lot of our information from reading in the media, that many who carry the virus might be asymptomatic. Do you think it's beneficial to have everyone tested in Connecticut, or at least a limited group of people, or only people with symptoms? And then is it possible to test to everyone, or a huge group of people?
Yeah, that's such an important question. So at first, we really focused almost exclusively on symptomatic patients, and some of that did pertain to the earlier 2 months ago when we had limited testing capacity. But certainly the research has shown us that a large percentage of people with COVID-19 are either asymptomatic or what we call pre-symptomatic. So they don't have symptoms at the moment, but in the days to come will actually develop symptoms. So even before they develop symptoms, they're still infectious to others and test positive. So I think, you know, our general approach to testing, and this is something that sort of the state has been adopting, is to test widely, but also to test smart. So what I mean by that is, you know, we do want to test a large percentage of the population and really understand what the prevalence is of infection at a given time. And Governor Lamont actually is launching a program to do widespread testing throughout the state. I think he's looking to test, 1,400 random individuals in Connecticut to just understand kind of the overall prevalence of infection in Connecticut. But by testing smart, I mean really targeting is in addition to the widespread testing and kind of the sampling throughout the state to understand the overall disease level in the community, is to actually focus in on those populations that are at highest risk. And by highest risk, I mean both at highest risk for becoming very sick if they do become infected, groups like the elderly, immunocompromised, really thinking about testing them at a much higher level, but also individuals that are in settings where they're more likely to infect other people. So thinking about settings like nursing homes, we've seen a lot of infections passing through nursing homes. Other congregate settings, there's talk about the university. We work closely with the university and stores trying to come up with a plan to test widely in the university, because we know that that type of congregate setting is a hotbed for potential transmission at a high level. So, we're thinking test widely to get a sense of what the overall prevalence of the infection is at a given point in time, but then also to focus in on certain high-risk groups concomitantly to be able to intervene should we find high rates of diseases in those certain types of settings.
So along the same lines, because you mentioned the research at the beginning, what percentage are people talking about of the asymptomatic? What percentage of the population, what range are you hearing, at least in the research? And along the same lines, we hear anywhere from 5 days to 14 days that you can be, not have the symptoms, but have the disease. I know you can't give us a specific number, but you're way ahead in the research compared to us. So I guess if you have any information on those two things, it would be really helpful.
Yeah, I mean, it's a great question, sort of what percentage of all infections are asymptomatic. I mean, at first we used to think that was probably in like the 5% range or so, but it looks like that's creeping up into maybe 20, 30% of all the people infected are asymptomatic. The challenge is to distinguish who is totally asymptomatic or who is pre-symptomatic. So who is asymptomatic, today on Wednesday, and test positive, but is going to develop symptoms on Friday. Two different groups that would both test positive and both potentially be infectious. But I think we're still learning in that area, but over the last couple of months, I've recognized that group is actually increasing. Really a critical group to identify in order to prevent further spread within the community.
Sorry. I'm just checking the time. I apologize. Have there been any children in Connecticut with a multi-system inflammatory syndrome? And if any parents are seeing any signs of symptoms, what do you suggest they do?
Yeah, that's great. So the multi-system inflammatory, or the multi-inflammatory system is a disease of children, although the CDC does define it up to age 21. So we haven't had any patients with that syndrome at UConn, but there have been patients in Connecticut. Last I heard at CCMC, I think they had about maybe 7 or 8 children, and I know Young New Haven's had more than that. So we haven't seen it in Connecticut. Essentially, it's a disease where multiple organ systems in the body become very inflamed, and there's some relationship to COVID-19. We're still trying to learn a little bit more about that, whether it's an actual result of the infection or if it's sort of post-infection inflammation. So we still have a lot to learn, and both in terms of recognizing, but also diagnosing and the best treatment, I think is still being worked out. In terms of symptoms to identify, it's a little difficult because some of those inflammatory symptoms that we see in kids are associated with other kinds of infections. So, the flu, other types of viruses. Now we're heading into tick season. So fevers, in the summertime, we often think about tick-borne infections here in Connecticut. So, I think the bottom line that I would counsel parents is that if you start to see that your child is developing fevers or new onset of what we typically think about viral symptoms, maybe severe fatigue, weakness. Sometimes the kids present with gastrointestinal symptoms like diarrhea or vomiting. Really getting that evaluation from the pediatrician and kind of having that low threshold, to get evaluated, both to look for the inflammatory syndrome associated with COVID-19, but also for other causes too, that we can see in kids. And there would be some testing that would be done. In fact, that is a role not just for the PCR testing for COVID-19, but also that antibody testing can be helpful in making that diagnosis. But having a low threshold to seek care from your pediatrician, I think is the bottom line, because this is now on the radar for all the pediatricians, here in Connecticut and throughout the country.
Absolutely. Dr. Banach, I thank you so much. We could probably ask you questions all day long, but I was told from the beginning to try to stick to our timeline.
I'm happy to help with any questions. And of course, if you email Dr. Agwunobi with questions, or you're welcome to email me, I'm happy to respond to any questions.
And thank you so much for all that you're doing for Farmington, for Connecticut, and for this country. So,
all right, thank you for inviting me to come.
Thank you.
It is my pleasure now to introduce Governor Ned Lamont. Governor Lamont, welcome to our 2020 Spring Business Breakfast. Over the past several months, you have skillfully, thoughtfully, and responsibly guided us through this COVID pandemic. We in Farmington would like to thank you and your team for all you've done. On a personal note, your reasoned approach has made me feel safer in this very unpredictable and scary time. I'm so grateful to you and your team and feel extremely lucky to be a resident of Connecticut.
Thank you, Amy.
This morning, we will ask you to help us look forward. How does Connecticut's future look as you outline your 30, 60, and 90-day action plans? Governor, welcome, and please take it.
Well, let me just say, yeah, Dr. Banach, because I'm not Dr. Lamont, I'm a history major, to tell you the truth. That's why I tried to surround myself with the very best scientists in the world, and thank God we have them right here in the state of Connecticut. Dr. Agwunobi and UConn Health has been invaluable for us, rolling out and ramping up our testing. Dr. Koh, Dr. Lee, we had a scientific team that helped lead our work through the peak of the pandemic in April, where we were really worried that we might be overwhelmed. We saw what was happening in Queens and Italy and the such. That never happened, and in part, Dr. Agwunobi can speak to this as well. Our hospitals worked together as one. And we were able to help out in the southern part of the state when they were overwhelmed, and then vice versa later on. And Dr. Banach, you're exactly right in terms of what our testing strategy is. You know, in part thanks to UConn Health and other great labs around the state, we've tripled our capacity just in the last 20 days. And I hope we're going to be able to double it again very soon. And you're right, we tried to focus on those that were symptomatic and frontline responders. Now our first line responders are also doing asymptomatic, testing everybody in the nursing homes. And particularly in our urban neighborhoods, where you're much more likely to be infected, much more likely to get complications, much more likely to have a flare-up. We're doing big testing there as a priority going forward. And I know you've got your questions. I'll just say, I see David Lamont on the phone. At the same time that we make public health front and center in terms of everything we're trying to do, that also goes hand in hand with slowly reopening the economy. Because if consumers and employees don't feel safe, I can pass any executive order I want, not much happens. And so there, we kept open manufacturing, construction, which, outdoor parks and beaches, things that our neighbors closed down. And now we're very carefully opening up outdoor dining. Outdoors is obviously so much better than indoors for us. We're going to be doing something today, maybe on outdoor graduations, as we think about how we can slowly reopen the economy. And I'd love your feedback, whether you think we're going too fast or too slow.
Okay, are you ready for questions, Governor?
Oh.
We'll just start with a few. Again, these come from the business community in Farmington. The first one is contact tracing has a very important role in containing the virus. How many contact tracers are necessary in Connecticut? And if someone is interested in that type of work, where do they apply?
Well, Dr. Agwunobi can probably help me out with this, but
Okay.
the pros that I've been talking to have generally said maybe one contact tracer per 10 or 12 new infections. The question being, how many contacts were they in? So if they had a small number of people that we have to contact, we can do more there. Let's say we're averaging 400 or 500 new infections a day. And as we ramp up our testing, I don't think you're going to see the infections going down. Although the positivity rate, Andy, went way down. We're down less than 5% for the last 3 or 4 days, which is not a big sample, but it's a sample. And we are working through our local health departments, Amy, and they're ramping that up. We have hundreds of folks right now doing the contact tracing, and we've got online learning as well as a lot of hand-holding as we put this on their shoulders.
The next question relates to hotels. With hotels opening on June 20th, the business community in Farmington would like clarification around the size parameters of holding business meetings beginning in phase 2. In particular, hotels that have the space capacity to provide greater social distancing and can meet current guidelines. Similar to the restaurant guidelines of 50%, will the same rules apply to business meetings and everything be based on square footage?
Well, Amy, one of the nice things about being governor is you're allowed to delegate, and that's what I plan to do with David. Let me just say broadly, what David has really taken the lead on is we've opened up, outdoor dining and indoor stores and barbershops and salons as of a few days ago, and hotels scheduled for June 20. He has been working very closely with the associations. So together, we come up with a set of very clear protocols. And that's meant to, A, make sure it's doable, make sure it gives people a sense of confidence going in, and probably gives some type of protection as well, liability-wise. If you're following the protocols, at least you can say, I did what I could. David?
Thank you, Governor. Good morning, everyone. So to answer the question, I think the way we view hotels right now is I don't believe there will be an occupancy restriction as it relates to rooms. I do think, though, as it relates to common areas, though, we're going to encourage social distancing, frequent cleaning, obviously masks. I think when we talk about meetings, indoor gatherings in hotels or other spaces, that's still an area where there's significant concern from a health perspective. So right now we have a 25-person outside, 10-person inside gathering limit that will likely increase as we get to that June 20th and around June 20th date. At that time, when we increase it, we'll put out formal guidance for indoor meetings, and that'll apply to hotels, other venues as well, but it's still likely to be quite small. But I think for hotels themselves, as it relates to their rooms, we're not going to limit that. We think the people are going to start moving about, and the market itself is going to provide its own view in terms of who wants to travel, business or leisure.
Okay. And you know what, I think this is probably an appropriate time to ask another question, both to the governor and to David. Farmington is the home for a lot of event planning businesses, wedding businesses. When do you anticipate we will be able to host events again? I understand there's an indoor and an outdoor answer. Feel free to elaborate.
So, Governor, do you want me to start or you want to start?
Go for it.
On this one, and this is where we've tried to take the lead relative to peer states. So we're trying to provide clear guidelines. So as of the June 20th date, groups of 50 are going to be allowed outside. And then for our phase 3, which is likely mid-July, is going to be 100 outside. And obviously that's contingent on the data continuing to look good and go the way it's been going. And listen, we're hopeful that those numbers can increase. But as opposed to just saying it's TBD, we wanted to provide some certainty. But if someone wants to know if they could do a 500-person wedding outside in August, that's a maybe. We'd love to say they can, but it's really, anyone who tells you they know what August is going to be like is not telling the truth. But I listen, I think that's possible, Amy. I just don't know if it's probable. But we're trying to provide as much certainty as we can in terms of what we think is doable. But big events outdoors, we do think that is possible later this summer.
Okay, positive. We just need the weather to cooperate. The next question probably is more for the governor. It comes from one of our businesses in town, one of our business owners. You will make some decisions concerning the upcoming budget. Would you consider rescinding the state government's employee salary raises of 2021? Could that $300 million be reallocated to small business lending employment package? Would that be, in quotes, a share expense? State employees foregoing a raise for someone out of work.
Yeah, Amy, look, I share those sentiments totally. What they do in politics is they make commitments on their watch that their successor has to honor. And they put in place a contract some years ago, and that contract said, I had to make a raise last year and a raise this year. Right. And that's a bipartisan way they do business, by the way. Right. So that's a complicated way of saying, I've asked the labor unions in no uncertain terms. I actually made a deal. I tried to make a deal. I said, look, you've got a lot of your folks, frontline workers, nurses, social service workers, corrections officers. They were in the front line. They were working hard. They were, in many cases, getting infected. I think they deserve some type of combat pay as thanks for the work they did. For the broad group of state employees, I said, let's defer the raise. I've got a 20% plus unemployment. I've got people getting furloughed. I think you should defer the raise. I think it would send an amazing signal about how we work in collaboration with labor. I haven't gotten much progress on that, Amy.
We appreciate the efforts. You have the hardest job around right now. Let me ask you actually, and this is my own question, only because there was an article, I don't remember what newspaper came out last week, talking about how the Connecticut unemployment rate seemed to be the best in the country. But your numbers are 20%. I trust you, Governor, but I'm just trying to understand all this different information could be confusing to the consumer. Can you just chat about the unemployment in Connecticut?
I'll start and then delegate again. But one of the things I've noticed is while you have 500,000 plus people who have filed for unemployment, and you say that's 500,000 out of, I don't know, 1.7 people working, you say 1.7 million. My God, that's an incredibly high unemployment. Many of those are duplicates. Many of those are double counted. So I think David and I think the number is relatively probably higher than what is reported, since there's a little catch up going on in the unemployment rates. I'd say the good news compared to our peers, Amy, is again, manufacturing, healthcare, although that's not quite as recession proof as we had hoped, outdoor construction. We've kept 3/4 of our GDP going and opened up now. It's the service sector, obviously bars, restaurants, salons, that is taking a little longer, but that's where the people are. That's where the unemployment is. And that's why we're trying to give them confidence to get back.
David?
I would just add, I think that's right. And there's going to be a lot of volatility in this number. So I think it is in and around 20% right now. My personal view is that's where the national number is. If you do, and we'll see, I think Friday, where the May unemployment number is nationwide. But 20% plus or minus, obviously, whether it's 22 or 18, it's an economic travesty that's happening right now, and we need to get folks back to work. I think you are seeing that as businesses reopen, as some of these PPP loans, of which there's 6.7 billion across almost 60,000 businesses in the state. You're going to see people come off the unemployment rolls and get back to work or get paid through PPP. And listen, we're hopeful that the recovery over the end of this year and through 2021, you get back close to where we were around that 4% number, but it's going to take at least 3 or 4 quarters and potentially 5 or 6. So we just need to keep doing what we're doing. I just can't underscore the point enough. The governor mentioned, we wanted to strike the right balance with keeping manufacturing open, with construction, with retail allowing curbside pickup, because we realized back in March, it's a lot easier just to stop the economy than it is to restart it. And we wanted to keep as much of it going as we could.
And as the governor said earlier, and I think this is so important, people need to feel comfortable. I mean, your executive orders are very important, but if I don't feel safe going into a restaurant, it doesn't matter, quite frankly, what you tell me to do. So the more people feel safe, the more they're confident, hopefully the quicker things get back to normal or close to it.
I would just, Amy, on that point, so we do surveying every 2 weeks now, and Connecticut residents that want to go to a restaurant indoors, only 1 in 3 said they would do it.
Yeah.
If you ask the question outdoors, 2 out of 3 will do it. So it's not just, the government's not trying to limit this, it's just good business to have outdoor options available, again, pending the weather, because people are going to vote with their feet here as they get comfortable.
Right, absolutely. We're going to do a slight detour here that actually doesn't relate as much to the pandemic, but we have you both present, so we're going to take our opportunity. As you know, we are blessed in Farmington with a vibrant bioscience cluster. This cluster, as you know, anchored by Jackson Labs, UConn TIP program, and one of the largest and ever expanding medical office campuses in the state, delivers tremendous economic impact to both the state and even more significantly, impact to the health of Connecticut. Earlier this year, the state legislature's Bioscience Caucus was briefed on next steps as to making this blossoming bio industry a national hub. And there was discussion of that hub being New Haven. What will Farmington's bioscience efforts, which is, as we all agree, have been taking off, be considered in this effort? And it really could be more of a statewide versus targeted just to New Haven.
Yeah, I'll start. Look, we're a small state. So,
yes,
Haven, UConn, we're all in it together. It's a short drive. I got to make sure that everybody is collaborating, first of all. Okay. And the Yale New Haven and UConn Health are like this, not just when it comes to dealing with the pandemic, but going forward in terms of research. Amy, look, let's face it, the last 40 years maybe defined a little more by computer science and in that tech world, and that was not necessarily Connecticut's strength. But I got to tell you, life sciences and biosciences, UConn Health, Jackson Labs, Yale New Haven, Semaphore, I mean, we are leaders here around the world right now. And I think that's going to really be an important focus for David and I as we try and recruit other companies interested in joining this broader ecosystem. And yeah, UConn Health and Jackson is a big part of that. And I just also say more broadly, our phones are ringing off the hook right now. Our meaning DECD, real estate, businesses. There's a sea change going on where maybe, 10 years ago, if I'm not in a major metropolitan center, I'm not going to be hanging out with the cool kids or something. And I think right now we're finding having a little backyard, not necessarily, being on the 50th floor. There's some real advantages to that, not having to get into Metro North or, on a daily basis. So I think you're going to find a sea change in terms of the demographics here. And I think life science is going to be a big part of that.
Okay, and we know you will, but we need to be advocates for our town and our area. Remember Farmington, because we have so many good things here. And as you said, we're a small state. Everyone can prosper. Everyone can be successful. David, do you want to add anything to that, or you're good?
I would just say we are a small state, and if you look at Massachusetts and their success, there is kind of the center, which is Cambridge, but when you have that center being successful, the whole state, it basically becomes successful. And I think that's a similar framework. I mean, the reason why, the comment, and I may have made it as it relates to New Haven, when you look at where the IP and the patent activity is that's generating a lot of the commercialization, ultimately, a lot of that is in and around Yale. But again, we think the whole state, including Farmington, will be a part of this. We just need to get the center of that right to make sure the whole state can benefit.
And whatever we need to do to work with you, we're here to do it.
No, and I visited TIP, and I'm a big believer. So Farmington is definitely on my mind, Amy. I'll never.
Excellent. Thank you. Excellent. The next question, unfortunately, it's an important question for all of us. If the number of positive COVID tests rise, what happens next? What do you intend to do to contain the virus? And is there a chance we're all going back in our homes?
We had Scott Gottlieb and Zeke Emanuel. They were sort of two of our advisors. Mm-hmm. And they said, we think we have some window through the summer. That's provided there's no Lake in the Ozarks moment. Somebody gets infected at a casino or at a protest and we have a flare up. But if we maintain our discipline, Amy, we feel like we have a pretty good window through the summer. Our worry is October, November, a second flu season. And my instinct on that is, we've told our universities, for example, in all likelihood, you're getting a go-ahead. In all likelihood, your baseline is you're going to have residence halls open this fall. Probably we'd like everybody to get tested going in, but be ready because we may have to change course. If we find there are these flare-ups, if we find our hospital capacity is getting tapped out closer again, we're going to have to throttle back. But something that David and I feel really strongly, just in terms of business confidence, is better to open slowly and methodically and not have to turn back than to rush into something. South Korea just had to close their schools. They were opened up until 5 days ago. I don't want that to happen.
Mm-hmm. And the university, and the gentleman who's kind enough to help me with technology today, which there's no way this would happen, but for him, his son is supposed to start UConn in the fall. It's very complicated for people to make life decisions when life is fluid. But you do anticipate, with respect to the universities, you do anticipate things will likely start in the fall and then we'll wait and see?
We had, Rick Levin and Tom Katsouleas, an amazing group of university leaders put together the game plan. They said community college a little more like business. They can go now. There's no residential living, so it's easier to do. Mm-hmm. Graduate housing first. Maybe graduate students are a little more likely to socially distance than an undergraduate. Did you ever see Animal House, for example? And then we figured, look, maybe you start off with some distance learning in August, early September, so people don't all move back into the residence hall the same day, but over a couple weeks you can do that safely. And a number of our universities, Quinnipiac, I think UConn, are planning to follow more or less that metric. And I think it's a thoughtful metric.
It's complicated, but we appreciate any insight. We're done with the questions that were sent to us, but if either of you want to pass out any other information, both to the business community or Farmington generally, please, at this time, we have a few minutes, feel free to take them.
Well, I'll take just 1 minute.
Sure.
We need your feedback. There's no textbook for how to do this. David and me and Dr. Agwunobi and our science team, we're working every day to find the right balance going forward. Nothing is risk-free. And so I need the feedback from the folks you're representing right there in terms of rules that they think A, are prudent and give customers confidence and employees confidence that they can get back. B, places you think maybe we're a little extreme. I don't think that's our case, but we're going to have another round of opening. It's going to start on June 20. David's going to get out a set of protocols, I think within a day or two. And let us know what you think because we're working this together. Thanks, everybody. Nice to see you.
Thank you so much, everyone. Thank you, Governor. Thank you, Commissioner Lamont, Dr. Banach, Dr. Agwunobi. This has been extremely helpful to hear what you've all done, to have the opportunity to thank you, and to try to get a glimpse of what happens next. We realize you're all busy, and the fact that you took the time this morning to talk to us, we couldn't be more appreciative. As for our attendees, thank you for joining our virtual breakfast. Hopefully next time we're all in person. In the meantime, number one, please support local businesses. Follow us on social media, check out Explore Farmington for the updates of what's going on in the community and business. And most importantly, stay safe, stay healthy, and have a great week.